Hi everyone, I am Dr. Atar Rahman Khan, consultant in internal medicine. Today I am going to talk about stroke. What is stroke? Stroke is sudden blockage of blood supply to your brain, some part of your brain. The brain cell will die within a few minutes if blood supply is not restored. What are the clinical manifestations of a stroke? FAST is an abbreviation. Will tell you that how a stroke take place. F, face. When you look at the person that he has a stroke, you may be suspicious if his face is all on a sudden one side of the face become asymmetrical. When he is asked to smile, he cannot smile completely, one side is going down or going shaping otherwise abnormal. You ask the patient to raise both arms above the head. One of the arm will drift downward. Then patient has a stroke. Then S stands for speech. You ask the patient to tell his name, or you make a sentence or phrase, ask the patient to repeat the phrase. Patient will not be able to make the sentence without slurring. Then it is time to call ambulance. FAST first. F, face. A, asymmetry, arms asymmetry. S is speech. T is time to call ambulance, 911. When you call 911, immediately patient will be transferred to the emergency room. Even on the way to emergency room, some of the hospitals in the United States, they have ambulance equipped with CT scan. The CT scan will determine what kind of a stroke you have suffered. Then you are taken to the emergency room. Emergency room physician will evaluate you. If he has decided that what kind of a stroke you have, then the treatment will start promptly that can save your brain, save your life. So it is a matter of time. Time is brain. Once you predict there is a stroke is in progress, then it is imperative to call ambulance right away. It is, if you don't have an access to an ambulance, you have to drive, or somebody has to drive you to the nearest emergency room which is qualified to take care of the stroke. A stroke is a life-threatening situation. Clinical manifestation varies from person to person. Usually patient will not be able to talk clearly. Patient will be confused. Patient may have numbness. Patient may have paralysis of one side of the body. Patient may have dizziness, and patient may be looking around, cannot make a sentence, cannot communicate at all. In that situation, you have to take the patient as quickly as possible to the emergency room for possible clot busting treatment like TPA. TPA is very good, and it is life saving, and it is given for ischemic stroke. There are other stroke. Most of the strokes are ischemic, meaning that your blood vessel is blocked by a clot either arising outside the brain or inside the brain. Another kind of stroke is called hemorrhagic stroke. In that circumstances, the brain will suffer a bleeding. The one of the blood vessel may burst, such as aneurysm of the brain artery can burst, and bleeding will exert a lot of pressure on the brain tissue, and patient will suffer a stroke. If a stroke is not managed within a few minutes, patient's cell will die, brain cell will die. Since treatment is available, fortunately United States and many other countries in the world it is imperative to know what is a stroke and to follow the guidelines. Time is brain. As soon as you take the patient to the emergency room in the qualified hospital for taking care of a stroke, the patient life can be saved. There are other kind of stroke which we call TIA, transient ischemic attack. In that circumstances, patient will suddenly may be blind in one eye or both eye, maybe numbness in one arm or both arms or both legs. Patient will not be able to talk completely. Like as I said, first FAST, face will be asymmetrical. Patient will be told to smile. Patient will not be smile completely. One side of the face will be drifting. Patient will be asked to raise both arms. Patient will not be able to raise both arms steadily and completely. One of the arm will drift downwards. Then as speech, patient will be told that what is your name, or you have made a sentence. Patient is asked to repeat the phrase that you have said. Patient will not be able to make that sentence, or he will have a slurred speech. Then it is time to call ambulance. There is no difference what kind of stroke you have. The clinical features are essentially same. If patient has a TIA, transient ischemic attack, this will resolve within a few minutes or maximum by a week. If a patient has suffered a TIA, there is a risk of 1/3 of the patient will develop stroke eventually. 50% of that stroke will take place within a year. The most risk is within 90 days, even a week. The first week is very, very important because there is a risk of stroke, complete stroke in a week to 90 days, and 90 days to 1 year. 25% patient, 33% patient may develop a stroke, 33 or above. Stroke is mostly preventable disease. Stroke does not take place overnight. There has been something cooking in your brain, like you have uncontrolled hypertension, uncontrolled diabetes, uncontrolled atrial fibrillation, uncontrolled coronary artery disease, or uncontrolled any other heart disease or autoimmune disease. If you are addicted to cocaine, or you are an alcoholic, or you are a substance abuser, there are risks that you may suffer from a stroke. If you are suffering from morbid obesity and obstructive sleep apnea, then you have a risk to develop stroke. Prevention is better than cure, so it is essential to be in diet and exercise in order to prevent hypertension or control hypertension, diabetes, and complication of diabetes and hypertension. Please follow me in the days to come. I will deliver more video. My request to you is to send the message to all of your family members and friends so that you know what is a stroke, because in a few minutes, if you are able to diagnose yourself or can predict a stroke is in progress, you can call ambulance and get the patient in the hospital as soon as possible so that his or her life can be saved. Because stroke patient may suffer from a long-term disability which can be prevented if stroke is diagnosed very quickly. Once stroke is diagnosed, treatment is given, then rehabilitation, physical therapy or occupational therapy will start from the hospital. Thank you so much for watching. Please subscribe my channel, Dr. Ataur Rahman Khan. I wish you all the best. I hope you or your loved one will never suffer a stroke. And please take an action, be proactive, follow the healthcare guidelines, follow CDC guidelines, how to prevent stroke, how to control your hypertension and diabetes and all other comorbidities that can lead to stroke and disability. Thank you so much again.